Going live now. Good to go, Karen.
Yep. Sorry, my notes just popped down. I'd like to welcome everyone to this week's community update. As you're aware, we're having this update a day early for the Easter holiday. So for those that celebrate Easter, I know it's going to look different again this year, but it helps to know that we're getting closer every day to being able to spend time with loved ones in person. We're reaching new vaccination milestones each week, so please celebrate responsibly and only with the people from your household for one more Easter so we can slow the spread of COVID-19 and return to normal traditions and celebrations sooner rather than later. Regional Council showed support for local businesses last night by approving $1.1 million for economic recovery. This funding is for two programs supporting local businesses: a COVID-safe ambassador program for small and medium-sized businesses, and a personal protection equipment and COVID-19 retrofit program. Businesses have been asking for increased clarity and information on how to operate safely in different stages of the province framework. And the COVID-safe ambassador program is a direct response to this need. Local businesses requested 300% more funding than was available. As part of the Regional Council's vision for beyond COVID-19, the doubling of this program is part of our $3 million strategic investment through 2021 budget to help alleviate financial pressures business owners have been forced to take on. It's the first of its kind in Canada, so we're thrilled to be starting it here in our region. We're certain it will help increase customer confidence as our region moves to economic recovery. More information on the COVID-safe ambassador program and applications to apply for the retrofit PPE funding will be available in the coming weeks. Thanks to the Greater KW Chamber of Commerce, the Cambridge Chamber of Commerce, and Explore Waterloo Region for their partnership and assistance in these programs. Now for an enforcement update. There have been 8 enforcement actions since the last media update. 5 charges for reporting period March 25th to March 30th. 3 charges were from the previous reporting period, but were not reported at the time of that update. City of Cambridge issued 1 ticket to Silver Spoon Restaurant in Cambridge for failing to comply with a continued order regarding employee screening, the use of face coverings, and being open for business past hours permitted. That's a total ticket of $880. The City of Waterloo bylaw issued 1 ticket at a private residence for a gathering. That ticket was $880. The City of Kitchener bylaw issued 1 ticket at a private residence for gathering, and that was $880 ticket. GRT Security issued 2 tickets on the Ion block line station for failing to comply with face covering bylaw, and that fine is $240. The Region of Waterloo Security issued 1 ticket at 150 Main for failing to comply with a face covering bylaw. That too was $240 fine. The Region of Waterloo bylaw issued 1 ticket to the Nazarene Apostolic Church for failing to comply with a continued order for failing to ensure the use of face coverings as required. That was an $880 ticket. The Region of Waterloo Public Health issued 1 ticket to Shinhua Asian Cuisine in Waterloo for failing to comply with a continued order regarding physical distancing, PPE, screening, and no safety plan available. That ticket is $880. So I would now like to move to an update from our Medical Officer of Health, Dr. Shuli Wong. Dr. Wong, you have the floor.
Thank you, Chair Redmond. Hello, everyone. In regards to our overall trends, Ontario is in a 3rd wave. Though our cases have not increased at the same rate as other communities in the province, I am concerned because we are starting to see an increase in our case rates again. Based on our data reported on March 31st, our current incidence rate has increased and is currently at approximately 50 cases per 100,000 per week. We are currently managing 305 active cases and 17 active outbreaks. Taking into account interim data, our latest percent positivity has increased to 2.5%. Our latest reproductive rate has also increased to 1.2. The indicators for Waterloo Region are showing that cases are continuing to grow, and they are now again within the red control level of Ontario's framework. The situation across Ontario is very concerning. Regarding the variants of concern, we continue to see an increase in variants. To date, a total of 433 variant cases have been identified in Waterloo Region. Of that total, 27 have been confirmed as the B117 variant, and the remaining 406 cases have screened positive for a variant. Variants of concern are now the predominant strain in Ontario and are driving the third wave. The percentage of new cases screening positive for a variant is now more than 60% in Ontario, and more than 23,000 people in Ontario have screened positive for a variant. Although the growth of variants has been slower to date in Waterloo Region than in Ontario overall, the variants will continue to grow, and our situation remains precarious. In closing, I recognize that it has been a difficult and stressful year. For all upcoming holidays and celebrations, please continue to only celebrate the people you live with and gather virtually with everyone else. I am grateful for your efforts. They have had an effect and can continue to have an effect. Public health measures are not easy, but they are effective. And these measures continue to be essential, even for those who have received a vaccine. Ontario is in a third wave. Our rates in Waterloo Region have started to increase again, and we continue to be at risk for a rapid acceleration in case rates, which is occurring in more and more areas of the province every day. It is expected that the Premier will make an announcement later today. I recognize that stricter measures will be difficult and present hardships for many in our community, but they will help control the impact and extent of the third wave in Waterloo Region as well. An uncontrolled third wave will necessitate longer and harsher measures. Thank you all for your efforts. I'll now turn it back to Chair Redmond.
Thank you, Dr. Wong. Deputy Hilton, over to you.
Thank you, Chair Redmond. Good morning. I would like to start with a reflection on the vaccine rollout plan. More than 11% of Waterloo Region residents have received their first dose of a COVID-19 vaccine, with over 82,000 vaccines administered in the region. Last week, the region saw a consistent increase in daily dose counts, with over 3,400 doses administered on March 29th and March 30th. We have moved into phase 2 of the provincial vaccine rollout plan and open pre-registration to more priority groups, including residents 60 years of age and older, faith leaders, those with highest risk in certain high-risk health conditions, including one essential caregiver for those in the highest risk and high-risk health conditions group. To date, 100,000 residents have pre-registered, with over 70,000 who have been invited to book a vaccine appointment. Last week, the largest clinic in the region opened up at Pine Bush in Cambridge, and at the beginning of this week, the Boardwalk Clinic moved to a larger space in order to fulfill our ramp-up plan. Primary care vaccination clinics are one of 5 types of clinics being implemented by the Region of Waterloo COVID-19 Vaccine Task Force. We have the Health Sciences Clinic located in Kitchener, which is a large clinic, and on March 27th, we saw the Elmira Family Health Organization begin to vaccinate their own patients currently eligible for the COVID-19 vaccine. This clinic is the first pilot of a COVID-19 vaccine clinic in Waterloo Region that is in a smaller primary care office. Now I would like to discuss the current and ever-changing vaccine landscape. I am pleased to report that our vaccine projections show a steady supply of Pfizer into the middle of May. However, there will not be an increase as we had originally projected in our ramp-up plan. We will continue to vaccinate thousands of residents a day, but not at the levels we were hoping to. The supply of Moderna vaccine destined to arrive in the region was delayed. We did not receive our full allocation. 2/3 of our immediate supply was delayed, which impacted doses available for booked vaccine appointments. We advocated to the province requesting assistance to bridge the gap in our shortfall, but needed to fall back on our contingency plan to close the Wellesley Clinic, cancel approximately 130 appointments, and delay mobile and pop-up clinics scheduled to administer the Moderna vaccine. However, yesterday afternoon, the province did confirm that they would assist and send the Moderna vaccine as requested. So we are incredibly thankful and appreciative to the province for their assistance. We anticipate reopening Wellesley next week and will continue to move forward with all our planned mobile and pop-up clinics. Receiving a steady and stable supply of Moderna is key in the continuation of our vaccine rollout plan. Now moving on to the AstraZeneca vaccine front. We received confirmation from the province that primary care and 18 pharmacies in Waterloo Region will receive the AstraZeneca vaccine as early as next week. Primary care locations will be communicated in the near future. And a reminder that these vaccines will be administered by appointments made at the specific locations and do not require pre-registration or booking through the regional booking system. In closing, I would like to caution everyone who has received their first or second dose of a COVID-19 vaccine, the importance to remain vigilant in adhering to public health measures. Thank you.
Thank you, Deputy Chief Hilton. Encouraging update. Nicole, do you have a question?
I do. Good morning. My first question is, we already know that the province will be instituting an Ontario-wide shutdown today, but under that structure, we understand that local public health units are supposed to be consulted and be able to tweak things in their regions. Were you consulted about this? You know, what will this mean for our restaurants, retail, personal service, and schools? And as the medical officer of health, will you make any changes to the provincial guidance for the region?
Thanks for the question, Nicole. So no, I was not consulted on this. In terms of what medical officers of health can do, they can layer on additional restrictions to what the provincial restrictions will be. So I need to first find out, like all of us, what those measures will be. I am waiting to hear the confirmation and the specifics from the Premier and the province later this afternoon, and then I will assess the situation. But the latitude for medical officers is really to impose additional restrictions on top of provincial restrictions, not to tweak them the other way.
Nicole, do you have a supplemental?
I do. I'm just wondering, you know, folks here in the region understand it's a long weekend. However, if the restrictions come into play on Saturday and you have the ability to, you know, make changes to request, hey, can you make them a bit looser for our region or tighter for our region? Will you then, you know, speak to the media in regards to these pending changes?
Yeah, I'll just confirm that I can't loosen provincial restrictions. What local medical officers of health can do, if we feel it's necessary, is layer on additional restrictions. So I'll have to see what the restrictions are like first to determine whether I feel there's any need for additional restrictions. So I'm not, you know, I don't have the latitude to loosen restrictions. And it's not the sort of tailored approach that maybe some people think is the case. This is if it's a province-wide lockdown or shutdown, then it's province-wide, and there are provincial regulations that form the minimum restrictions across the province. And in certain situations, it doesn't happen very frequently. It could be that a medical officer of health feels that the measures that are put in place by the province for their area is insufficient, and they can go above and beyond that if their situation warrants it. And so I'll have to see what the measures are, but we would be, a provincial lockdown would mean that we would automatically be moving into a higher category with more restrictions than what we have now.
Okay, Joanna, do you have a question?
Yes, this sort of follows on Nicole's question for Dr. Wong. We don't have the details yet or anything like that for the shutdown or lockdown, but do you have like a wish list of things you would like to see? Like, what do we need to keep things under control and from the third wave, like escalating to an uncontrollable place?
Yeah, no, thanks for the question, Joanne. It's a good one. I recognize that any decision that the province makes will be a difficult one, and I am sure that they are weighing all the factors that they should be weighing. And, I know that some people may wonder why there would be a province-wide lockdown or shutdown if not every area is experiencing the same type of resurgence or rapid acceleration of case rates. When case rates get to the point that they are at in the province, this is dangerous for all of us. These are very concerning rates. These are case rates, hospitalizations, ICU admissions that surpass the thresholds that we were at when we entered into a province-wide shutdown at the end of last year. So this is concerning, even though we haven't yet seen that rate of acceleration here. This is concerning for me as well. And a province-wide shutdown should be able to better control rates across the province. And if that is what they're going to decide to do, then that would be the reason that they would want to do that, because the experts, would have provided them advice, and it would be what they would determine to be the best solution for Ontario, including Waterloo Region.
Joanna, do you have a supplemental?
Yeah, so Dr. Wong, do you support the idea of going into a province-wide lockdown as soon as tomorrow?
Yeah, I respect that it's a difficult decision that the province has to make, and they are getting the best advice possible from the provincial experts, and so I would support their decision if it means that the province as a whole has to go into lockdown, because if that's what they are planning for the province, then this is what's best for the province, including for Waterloo Region.
Tim, do you have a question?
Yeah, good morning, Dr. Wong. I just have a question regarding the incidence rate. You currently said it's 50 cases per 100,000 per week. I was just wondering, how high can that go up? I'm assuming it can go up as much as possible. Where do you get really, really worried if that goes up even higher? Like what happens after that?
Thanks for the question, Tim. So at the peak of our second wave, we had rates of about 185 cases per 100,000 per week, which is way, way, way above the lockdown zone. So we were already in shutdown, which was a good thing, because if we hadn't been put into shutdown, we would have been put into shutdown. What's happened to London and Hamilton, for example, they've had to have the emergency brake used on them in the last week. This is very significant, and we've seen this now in more and more areas across Ontario, rapid acceleration of cases. So we're not immune to that. the only thing and the best thing that we can do is keep up our public health measures to reduce the chances of us going into rapid acceleration. But this is the nature of COVID. This is how it spreads. And unless you have public health practices and measures that slow the spread, you will see a rapid acceleration. So we experienced that in wave 2. At the peak of wave 2, our case rates rapidly accelerated after actually the provincial shutdown, because the case rates always reflect behaviors 2 weeks prior. And we saw a very concerning peak, about 185 cases per week. 185 cases per 100,000 per week, which is probably around, I don't know, 220 cases a day, right, in Waterloo region. And it is very tough because not only, obviously, it's much harder to control spread when you have many more cases, but it also inevitably always leads 2 to 3 to 4 weeks later, more hospitalizations, more outbreaks, more deaths. So it's not actually the numbers themselves that are concerning, it's what comes after the numbers. And so the best thing is to try to prevent that type of rapid acceleration, which we haven't experienced yet. So if public health measures are put in place earlier on, they will be more effective at controlling spread, because it's much harder to come down from higher numbers than it is to come down from lower numbers. Exponentially harder to come down from higher numbers. Hope that helps.
Thanks. Tim, do you have a supplemental?
Yeah, my next question was regarding vaccines, specifically AstraZeneca and the pharmacies. I was just wondering, Deputy Hilton, what was the logistics regarding that? Because you mentioned 18 pharmacies in Waterloo region. I just wanted to know how the planning was to assign those pharmacies, or if the task force had anything to do with it.
Deputy Hilton?
Thanks, Tim. I take no credit as part of the task force at all for the selection of pharmacies in the region. That was certainly done on a provincial basis, which again, AstraZeneca will be sent to the pharmacies themselves. So as part of the task force, it's lovely that we have more vaccines coming in, but cannot take any credit, and Dr. Wong can jump in there as well, but certainly can't take credit for making any assignments.
So as you may know, we have Dr. Kelly Grinrod on our task force, and she chairs a pharmacy working group that provides advice to us as well as to the province. And we've been very fortunate to have Dr. Grinrod and this pharmacy group, and the province has asked for our input. Ultimately, they make the decisions. They are working directly with the Pharmacy Association of Ontario. But we did have input into the selection of pharmacies, and one of the things we wanted to provide as input is a good distribution of the location, such that there was good coverage of our region, and in particular areas where we see higher rates of COVID-19. And so I just actually found out this morning, like you all did, that there's been 18 chosen, and they are listed now on the Ontario website, and I'm taking a look at them after this press conference, but it seems like there is good coverage, so we're very pleased about that.
And Mr. Lochner provided the link in the chat box for anybody that wants to cut and paste. I'm sure you'll wait till after this meeting to look, but it does list the 18 pharmacies in the region. Irene, do you have a question?
Yes, I have two questions, but I'll ask the first one. That was actually about the list of pharmacies. So I'll be checking out that link that we're getting, and the healthcare rollout. And Dr. Wong, did you mention that will the rollout be listed according to the province? The reason I'm asking is because there is a healthcare center in Ayr that is administered through Brant County. So my question would be that if the vaccine was coming to that healthcare center, is it for people who are in the like I myself go there knowing that my doctor and my services are in Brant County. So how would that be addressed?
Yeah, so it would, first of all, there's additional pharmacies, like we have 18 now starting next week that will deliver, or maybe some of them are, I think some of them are already taking bookings, so they may start this weekend. I'm not quite sure. Each pharmacy will make that decision themselves, but they'll all be starting soon. There's going to be more pharmacies. So this is not the total list. The province actually wants to double the number of pharmacies from about 700 starting in a few days to double that by the end of the month. So, that's just one thing I wanted to add, so that, it's not the necessarily the end of the list of pharmacies. In terms of your question, the practices would be supplied by the health unit that they're in. So if your practice is in Brant, it would be supplied by the Brant health unit in terms of the vaccine, because yes, the AstraZeneca is coming to pharmacies directly from the province. The AstraZeneca to primary care, the individual practices themselves for their patients is going through the health unit to be distributed to those practices, and it would be the practices in the health unit jurisdiction. I hope that helps.
Irene, do you have a supplemental?
Well, yes. And are you aware, you gave a percentage of people in the region that are being vaccinated. Is that also applying to the rural townships? We have had people come into the Air News that are telling us that they cannot get into the city and they're waiting till it comes out here. So my question is that percentage, is there a lower percentage of people in the rural townships getting vaccinated? That's my question.
So I don't know who wants to take that. Dr. Wong or Deputy?
I could start and surely jump in anytime. So the percentage that we have on our dashboard is the overall regional percentage. We don't have a further breakdown at this time.
Deputy?
Okay, I'll just keep watching for it to come out to North Dumfries. Thank you.
Yeah, and Irene, I did want to add, if like through the Moderna, sort of the delay in our vaccine arriving in the region did cause us a little bit of concern, obviously booking appointments, having to reschedule appointments, like I said, in Wellesley, Langs, North Dumfries Township and Ayr will still have a clinic. Our concern was when that was going to happen because of the Moderna, insecurity, I would like to say, but because the province stepped up and will be sending us what we had asked for to fill the gap. Our plans are to have North Dumfries, we're hoping the week of April 12th. So that we can have that clinic open. So it is coming to Ayr, but stay tuned, because as you know, the ever-changing landscape of vaccine, what I tell you today might change 15 minutes from the end of this media briefing. But that said, we do have plans for the Ayr clinic to open, I believe it is the week of April 12th.
Great, thank you.
Hala, do you have a question?
Yes, thank you. I was just wondering if we're seeing any lulls in local vaccination clinics, so time periods where there are no lineups or people missing appointments, and if so, how often is that happening?
So Deputy Hilton, do you want to talk about our end of day backup plan?
Yeah, it's a really great question. What we do is we're monitoring our clinics daily, obviously, with the amount of allocation of vaccines to each clinic based certainly on what the capacity is to deliver the vaccine, but more importantly, what the booking is. I mean, this is a great time, and I appreciate your question, a great time to remind the citizens of Waterloo Region that each clinic is open to anyone, and it's not just if you live in Waterloo, you go to Boardwalk. If you live in Kitchener, you go to Health Sciences. So we are encouraging people that when you do get your invitation to book your vaccine appointment, to please look. If it's not your first choice, but look at the other clinics, because there might be openings for you on the date you actually wish to be vaccinated on. More importantly, it helps assist us as well in terms of when we open further dates for booking as well. There are a lot of people who are waiting to be vaccinated. So when you do get your invitation to book, please do so immediately. It does just help with our planning. In terms of doses or times, sometimes we do see lineups, and I think the lineups is just, sometimes it's just process and flow, depending on how quickly we can get people in the door. Sometimes there might be people who move a bit slower, who have some difficulty with hearing. So it just takes the vaccinators or the screeners a little bit more time to get people through. And what we do is are very mindful of cancellations or mindful of missed appointments if people don't show. We do have a system whereby we will call those that have asked to be put on, and it's in our registration form, to be put on a short notice notification. So we will call individuals to come into the clinic on short notice. So that's our contingency plan in terms of extra doses or people who have canceled their appointments or have missed their appointments.
Hala, do you have a supplemental?
Oh, yeah, sorry. I was just gonna say, so is it like, how frequently are you noticing these, I guess, time periods or slowdowns, if you will?
That's a really difficult question. It's day by day, hour by hour. Interestingly enough, there are times that it does sort of even itself out. We have had individuals that have arrived at the clinic, the wrong clinic, for instance. And so if we've had a cancellation, we've been able to get that person into the clinic they showed up at. So, you know, it's really hard to say. Sometimes the beginning of the day might show more lineups. The end of the day, not necessarily. You know, we're trying to fill our clinics to capacity, and I know Dr. Wong might have something further to say to this as well. But it's really hard to actually pinpoint what time of day this happens and how frequently it happens, because it's really dependent on people.
Dr. Wong, do you want to add?
Yeah, I think I would just add, because I'm wondering if this is what you're getting at, Hala. I mean, we've seen the news stories of, you know, clinics in other areas of the province are empty or sitting empty for hours. This is not the case in Waterloo Region. I think one of the reasons that Shirley has difficulty, you know, or we would all have difficulty pinpointing exactly, because in general this doesn't happen. Yes, there are some minor fluctuations, but you know, there's a lot of work behind the scenes. Of members of the vaccine team who are watching the bookings and the you know and the vaccine supply really like a hawk, actually, we've been good at filling, you know, by and large, filling our vaccine capacity, getting out our vaccine as fast as it's coming in. In fact, we're very we're running very lean. So, you know, we're really counting on vaccine delivery to be delivered on time. Of course, we have some contingencies always in place for that, but, you know, I mean, our clinics by and large are being filled, well filled, and we're not really experiencing the things that, you know, we're hearing reported about in other areas. So there's some minor fluctuations from day to day, but by and large, we're doing well in filling our clinic capacity. And so if the clinic capacity goes down, you know, it would be a function of the fact that we don't, have as much supply, and that's why, we have to match the clinic bookings to the supply that's coming in.
Mr. Lochner, did you want to jump in on this one?
Sure. Just to add to what Deputy Hilton and Dr. Wong said, Paul, I think a couple of decisions that we made have given us, that advantage. One is the pre-booking, and we know it's frustrating for residents to wait. I pre-booked, weeks ago. When am I going to get my call? One of the reasons that that decision was made by the deputy is to give us that stream. And as Dr. Wong has said, our teams can look at this and start to add more flow if we start to see trends in vacancies or missed appointments. Deputy Hilton has also spoken to, in past meetings, the standby list that we have. And although I appreciate it's not easy for everyone to drive, when I think of our colleagues in the northern part of the province, they can't do the same thing we can, because we're able to reach a larger population within, a 20-minute drive to multiple clinics. So that allows us to reach out to those people, again, who are on the pre-registration list. And I think the third thing, we've heard some other major cities ask the province to open up more flexibility and start opening up to other groups. Because we're running our own system, we're able to open up to different groups and kind of customize and target groups according to the framework a little more nimbly. So I think those were really good decisions that the team made that have helped us in this case.
Thank you for that. Any further questions? Okay, and Nicole and then Joanna. Nicole, go ahead.
Hi, Dr. Wong, wondering if you can tell us more about the cluster in the university area. Is there an update there? Has it impacted our trends? And given the fact that, the modeling numbers indicate that the variants are having a much more serious outcome for younger people, paint us a picture in regards to your thoughts about how this cluster is impacting what's going on here.
Yeah, no, thanks. Thanks for the great questions, Nicole. Yeah, I'm very concerned, actually. I don't have a numerical update compared to what I presented last night, but I can say that going forward, it's not really going to be possible for our team to continue to track additional cases that are, tertiary or potentially onwards from there back to the original cluster, where it's just after a while that it becomes a community transmission. It turns into community transmission. So in other words, this large cluster has led to a significant community outbreak. That's what's happened. And while we follow up with all the cases, we will track all the outbreaks that we've declared at the university residences. We will have updates on numbers for that. Past what I provided yesterday about the total 85 cases that we've been ultimately able to link back to the original cluster. Going forward, we're not going to be able to track that completely anymore because it's become community transmission at this point. And this is the danger when people spread it amongst themselves, in gatherings, for instance, and then those cases then spread it if they have other gatherings or they mix with other people. They likely will spread it to those in their household, because that often happens. But then if they mix with people outside their households, then that will just open up more channels for COVID to spread. So it definitely has contributed to our increase in cases that we've seen in the last week. It's been all these cases, 85 in total, that have been confirmed to probable, and we have about 75 additional high-risk contacts who may turn out to be cases in the end. So this is a significant community transmission event now, community outbreak, and it has affected our rates, and it can lead to an overall increase that again, accelerates, as is the natural evolution of spread. But this is why when we do have these kinds of events and we do the case and contact and outbreak measures to try to control it, to try to keep it from spreading further. And the universities are helping us with that, with some additional measures that they've implemented recently. Well, they have been supporting us since the beginning, but they've implemented further measures recently to try to really get a handle on these outbreaks in the residences. So your question was about, so it is a significant risk for our community when you have that type of event, and it's led to community transmission. At any time it can happen with the variants. It will spread faster, and now we know from evidence that not only does it spread faster, but we now know that it is more likely to lead to serious illness. So that is why, even if our rates are comparatively lower to the province, and we haven't seen that rapid acceleration like some of our neighbors have, we are always at risk because of the fact that our indicators are not low; they're in red zone. They're in the red zone area, so they're high. And when you have high rates, you're always at higher risk for a rapid acceleration. And number two, we have the variants again. We've done a lot of work in trying to control the variants. We've implemented early on in Waterloo Region enhanced case and contact management, assuming all cases were variants. Now that does help slow the growth of variants, and we have been able to slow at this point growth of variants in Waterloo Region comparatively to the province. But again, always remains a risk. If you have a large event with a lot of spread and you have a variant in that event, then that will lead to many more variant cases. So it's always a risk. We're always in a precarious situation, and we will continue to be for the next few months until such time as we can have a significant majority of our population immunized or that has received at least one dose. So that's why we have to continue on with our public health measures and keep them up for the next few months. They will be our best defense against serious impacts coming out from a third wave.
Thank you. Joanna, you had another question?
Just two questions about vaccinations. You mentioned 18 pharmacies in the region. The province sent me like a list, Excel spreadsheet list earlier, and it included a Elmira Shoppers Drug Mart. And I wanted to know can you confirm that, or is that not actually among the local ones?
So we all got the news just before this media briefing, Joanna. So it sounds like your list is a little bit different than the one that's public now. And Dr. Wong did indicate that there will be additional pharmacies. So maybe you got an updated version that we didn't. Dr. Wong, do you want to comment?
Yeah, it looks like you got maybe an updated version that we haven't gotten yet. I know they're looking at more sites. So it could just be a question of, when additional sites come on board. But right now, what we have confirmed, I don't have information beyond what's on the Ontario website. And by our count, we did count them one by one. The total seemed to be 18. And it could be that additional pharmacies go on the list later. I don't believe Elmira is on the list right now, but it could happen later.
And just to answer Irene's question in the chat, the link in the chat is the 18 that was officially announced by the province. Joanna, did you have another question about the vaccine, or was that it?
I just with the vaccine clinics. I'm just wondering, are people being screened to make sure that they're local residents, or can people come from outside the region to be vaccinated here?
It's a good question. Across Ontario, it's the same rules set by the provincial government, which is that there are no restrictions that any area can make to who they offer the vaccine to. So yes, people from outside the region can receive the vaccine here, just like people here can go outside the region. It's not recommended that people travel outside their region during, the time that we're under red zone or possibly, a lockdown, unless it's to travel for essential reasons. But what we have been encouraging is that people who live here, who work here, and that they receive the vaccine here.
Hala, do you have, I know you're not on screen. Do you have another question?
I actually did. I had a question just about how often are COVID test swabs unavailable to be tested or show up as inconclusive, and what's the process when that happens?
Oh, COVID. Yeah, that happens. That happens. I mean, it doesn't happen for the majority of tests, but there's always a minority, and it depends on the lab. Some labs have an indeterminate range. And so depending on where the labs are processed, which could be anywhere in the Ontario lab system, right? It's not always a specific site for our samples because they want to make sure that it's fluid and they can send to whichever lab has the most capacity at any one time. We can come back with results that are indeterminate. And usually in those cases, we recommend that people be retested.
Any further questions from anyone? Seeing none. Thank you all very much. I hope everybody has a wonderful long weekend, and we look forward to some clarity from the Premier this afternoon. Everybody stay well, and I'm sure our paths will cross soon. Thank you all very much.